telling you about one case of a young woman therapist who was treating a very severely disturbed patient. And this is her account. It's not mine, it's her account. She wrote it for me. I was supervising her. So the therapist, Agatha, was treating a patient called Bernadette. This is the way Agatha describes it. As a young girl at school, Bernadette was bullied by her mates because she was fat and could not spell. She was also forced by a boy into having sex when she was about 11 or 12. Her mother disappeared to a big city when Bernadette was 13, but she searched for her in the city and managed to find her. Her grandfather and grandmother died when she was in her late teens. She had many changes of school, but at 19 she graduated and did well. And in that same year she met Sebastian, and in the end of that year she had an abortion. At 20 years old, she got a job in a bakery, and she was planning to earn money when later applied to train at a school of nursing. At 21 she became pregnant, and her son Christopher was born. And when she was 22 years old, she married Sebastian. She became pregnant again about a year later, and then a second son, Michael, was born. The condition, Bernadette is now not able to take care of him, and she developed a very severe depression, and she was admitted into a psychiatric hospital. Soon after being admitted, she cut herself for the first time. When she was 25, a close friend, also in the psychiatric unit, committed suicide. Bernadette then tried to strangle herself. Later that year, she was admitted to an institution, and when she was 26, she and Sebastian divorced. While at this institution, she sank a knife deeply into her stomach. And this is the first of 6 times when she did this. And it was not just sort of on the surface, she sank it right into the depth of her stomach. So by the time she was 28, she had had major surgery 5 times. And then she had a colostomy bag outside her stomach. It is later removed and the intestine system mended. The first try doesn't succeed. The first 2 or 3 times she plunged in the knife, there was no serious harm done to the intestine, but the 4th to the 6th times she nearly died. She's had 5 big and critical surgeries done, and the cost of her medical and psychiatric care over these 2 years amounted to $1,105,724.56. And Agatha continues, I heard of Bernadette for the first time when I was supervising staff at the psychiatric hospital. They were terrified because of her dramatic self-harming assaults on herself. For instance, she cut out squares of skin on her legs, put soil on it, flushed the skin down the toilet so that it could not be put on again. She put plastic bags over her head, tried to strangle herself, ate knives, forks, needles, and took overdoses. She was often put onto the belt, and she was heavily tranquilized and was treated with all kinds of heavy medication. The diagnoses changed from week to week. The staff didn't know what to do or what to think. The parents and Bernadette herself often complained and threatened to go to the newspapers because nothing satisfactory was being done. Then Agatha says, I started therapy with her in 2002 to 2003. Apart from holidays, I've seen her twice a week since then. Before I started with her, she'd had about a year with cognitive therapy. She hated it and still hates it when people present her with schemas and so on. She said she would have no more therapy. The nurses at my ward had suggested that she tried me, the new psychologist. She refused for about half a year, but then she changed her mind and said she would give it a try. In the very beginning, she would typically be amusing, telling jokes, but then she became more and more sleepy. Sometimes she fell asleep. She would constantly be looking at the clock. It was a very hard time to get her to speak at all. I often felt empty and would be trying this and that way of engaging her in a communication with me. Whenever she did say something, it was on a very superficial level. She would also complain about things in the ward and about problems in the bakery where she worked before being admitted to hospital. Often she wasn't allowed to go outside the ward and I had to bring her myself to the office. Sometimes she was allowed to go on her own. These were never my decisions. I never took away sharp things, for instance, the letter opener in my office. Sometimes she'd make jokes about it, pretending that she would swallow it. In the beginning, I laughed at her jokes. Then later on, I became more passive and quiet. I was often completely confused, desperately trying to get hold of that kind of pattern and dynamic that activated her self-harming actions. Then again later on, in fact, the last 2 years, I have in increasing degree felt the madness inside of myself. I've shared her madness. I felt the lack of shape, the lack of any transference that I could identify, and so on. I felt that I wasn't able to connect to anything of the kind that I thought I'd be able to do as a therapist. I couldn't have done without my supervision team and supervisor. I sometimes felt that if only they really knew what little I was able to do, they would not want to know me. At the same time, I knew that this was mirroring something inside of Bernadette. I also felt the shame, the need to get out of this, sometimes hoping that she would die and leave me a legitimate excuse to stop. For a long time, I felt completely without hope, and at the same time felt despairing and unable to contain all her self-harming acts and relapses to behavior which I thought had finished forever. For some time I wanted to confront her. When she was out of hospital in December, January this year, I found the right moment to tell her that I wouldn't be able to carry on with therapy if she sank a knife into herself again. She'd done it by this time 6 times, at that moment, she was in quite a good state. She was relieved that she hadn't died. She was able to understand my confronting her as an act of care and not condemnation. Earlier on, she'd have said, "Fuck you, you're just like all the rest," or something like that. I'd just like to interject something here myself. I was her supervisor, but this act of hers, when she told Bernadette that if she sank the knife in again, she wouldn't be able to carry on with the therapy, it came entirely from her. It wasn't any suggestion of mine. And I think that's something very, very important, that it's the only thing that really ever gets through to a patient who's in such a disturbed state as Bernadette was, if it comes entirely from within. It would have been no good if she'd said it because a supervisor or I had suggested she did that. And it was something crucial. And I'll come to this point again, that it's really only those utterances that come entirely from the person of the therapist that have any effect on a patient who's in such a disturbed state as Bernadette was.